Welcome to our session today on scenario-based learning. One of the techniques I found to be most effective for learners is the use of scenario-based learning. Scenario-based learning provides the learner the opportunity to prepare for actual situations that may occur during the clinical experience, as well as equipping them with the tools needed to prepare for the CNA certification. During our time today, I will offer some techniques to create scenarios to teach technical and soft skills. I'm going to provide examples or scenarios to enhance your educational environments and provide references for available resources. So let's go ahead and get started. Scenario-based learning is an instructional strategy used to facilitate an active learning approach. The use of real-life situations provides that opportunity to create a relatable learning experience. This method allows participants to become more engaged and build upon basic skills. Scenarios should be used after the learner has been given basic foundational information. So why scenario-based learning? Well, using this method enables an educator to validate the learning transfer process, facilitate application knowledge, establish behavioral changes, and increase critical thinking skills. So let's go ahead and do more with that. Health science has used the power of scenarios with standardized patients for years to help teach key nursing technical skills as well as important soft skills. Now, sometimes your scenario will include the use of something like a simulator or a hands-on resource as well. So here you see an example of two different ways to learn skills using simulators in scenarios. So the first photo is using a blood pressure simulator on a standardized patient. Now, you could create any scenario you want and have one student be the nurse actually learning how to take blood pressure for, say, a specific type of patient, and then the students can switch roles. The added benefit of a wearable simulator, such as a blood pressure simulator like this, is that the student is also practicing the soft skill of patient communication. Now, on the right, you can see a geriatric mannequin, very typical, that can be used for a wide variety of scenarios to teach and to practice all sorts of basic nursing skills, as well as soft skills like teamwork, communication, problem solving, and more. You could set up a scenario with students working as CNAs in a nursing home and give them a scenario where they have to perform something like a bed bath with this quote patient or do something else. The experience of walking in the shoes of a patient makes the discussion and learning richer. Prior to providing a scenario-based experience focusing on a skill like taking blood pressure, students might receive a lesson on key points about taking blood pressure. These points might include proper patient positioning during the procedure, proper placement of the blood pressure cuff, techniques to use the stethoscope with the cuff, how to inflate the cuff, how to properly read the gauge, and then finally how to document the findings. Now, a lack of understanding of these concepts may result in less, quote, buy-in of a scenario using blood or featuring blood pressure. So if you wish to teach soft skills specifically using a scenario, don't introduce new technical skills as well, because the focus will always shift to that instead. So here's a blood pressure scenario focusing on the soft skill of empathy. Now, this scenario in this lesson would come before the technical blood pressure lesson in order to engage students and get them to think about taking blood pressure in a more empathetic manner. But you could also use a scenario like this at the end of a lesson. In that case, it builds upon the knowledge that was learned earlier. So as you can see, the student has the opportunity to then pull knowledge together and begin to develop critical thinking skills. So now that we've seen how scenario-based learning can enhance an educational experience, let's actually build a scenario. So building scenarios that are realistic and meet the needs of the learner is key. Understanding the learner's perspective and key performance requirements will help you to create a learning environment that will cultivate the ability to transfer knowledge. So creating SMART goals is one way to guide the process of building a scenario. Your goals should be specific. At the completion of the training or educational experience, what will the learner be able to accomplish? What skills will be taken away from the training? Are you focusing on technical skills, soft skills, or both? So using the blood pressure example, a specific statement might be that at the completion of the scenario, the learner will understand their role in communicating vital signs to the healthcare provider or the process to the patient. So measurable, how will you know the objective is met? Using a checklist with specific skills and behaviors students will need to complete will help you create a measurable goal. Using the skills listing, such as the 2018 NNAP for skills evaluation, is a guide to build measurable skills, and it's one way to support the learning experience. So A for attainable, know the skill level and experiences of your learners. You should create an experience that is achievable but not too advanced for your learner. So relevant, R. Creating a realistic environment is very important when implementing a scenario-based learning experience. So using outdated tools and process can cause confusion. It can also decrease the effectiveness of the experience. And last is our T for time-based. Build scenarios that can be completed with within a designated time frame. Providing guidelines and parameters will help to build a realistic experience. Now that you've created SMART goals for the educational session, then you can take that content and define the desired outcomes. Now, for the current scenario we've been building, we can use the defined outcomes that are here on the screen. I've selected the soft skills of understanding their role in communicating vital signs to the healthcare provider. This intended outcome allows the instructor to determine the participant's ability to communicate and prioritize. Understanding the technical skills for taking a blood pressure would have been taught during the lesson at some point, but our focus here is intentionally soft skills. So integrate those key concepts that were introduced during the lesson and then take it a step further to determine if the learner can problem solve issues that might be present. This would correlate to the outcome of utilizing critical thinking skills to navigate barriers during the scenarios. These defined outcomes also offer a method of knowing when to stop the scenario. For instance, if you begin the scenario and you determine that the technical skills such as how to apply a blood pressure cuff or proper technique for hand washing are not demonstrated, you might stop or even pause the session. If a learner does not have basic knowledge about a process, it will be difficult for them to progress and use critical thinking skills. Critical thinking and problem solving are soft skills. So having a critical action checklist can help to ensure that there is mastery of this technical content in addition to the soft skill experience. A critical action checklist provides the learner and the instructor with a guide for the scenario. Once the learner understands the objectives, then the guide serves as a means to effectively accomplish the objectives. So we have the skills listing from the NNAAP, which we're using as a good tool to use as a guide for developing scenarios for nursing assistant students. It provides an outline of critical elements to be completed. These critical elements can be integrated into the critical action checklist. A sample checklist is presented here on the screen. This checklist includes the objectives that I've created for my scenario earlier, in addition to the critical element steps. The combination of these items are important considerations as we begin to create the scenario. Now that you've created the critical action checklist, let's begin developing the scenario. First, determine where you would like to begin the case scenario. Will this session start at the beginning of a shift, like during a report, or will this scenario take place in a community setting in the middle of the day? The starting point of the scenario kind of provides that framework for the learner. It allows them time to process solutions they've used in the past. Once you've determined how the scenario is going to begin, you can formulate the key points that need to be included in the scenario based upon your critical action checklist. Now, your next step is collecting equipment and supplies for that scenario. If this is provided in person, this would include or ensure that you need to have access to a blood pressure cuff, proper documentation forms to ensure that this scenario feels very realistic. If the session is being implemented, say in a virtual setting, it is important to test and trial platforms that can make the scenarios as realistic as possible. So a few tools like Mural, Miro, Menti, a Poll Everywhere, and Slat can be used to replicate methods of engagement. You might also search for video clips or pictures and images of items to be used during sessions to elicit further discussion. So be sure to recruit additional participants for a more realistic scenario. Now, this could be used simply assigning student partners to work together, and then finally determine what is a signal to end the scenario. Does the scenario end after a specified lapse in time, or does it end once the learner has accomplished all of the points on that checklist? Using real-life case scenarios can help to build the case narrative. Taking examples from student debriefs at the end of clinical experiences can provide insight into key aspects or takeaways. For instance, some students might offer challenges that occurred during their clinical day while caring for a client. A realistic case narrative helps to facilitate the learning experience. You can take some of the realistic scenarios and use them again in future classes. Now, instructor notes are simply tips and information that you'd want to remember as you facilitate the conversation and the scenario. It might be helpful to have some modifications to the scenarios available based upon the learner in the room. You might even consider having a track for a more advanced student versus that first semester CNA student. Debriefing. This is the most important aspect of the entire scenario process. Now, this process provides your insight on the scenario implementation, how effective the process was for the learner, as well as other challenges that might need to be addressed. Now, here's the following useful framework to use. Ask key questions such as, what went well? Have all the students share at least one thing that went well or one thing that was helpful during the time together from their viewpoint. What were the opportunities present, or what could be better with more practice? Have all the participants share one opportunity. Now, this can facilitate discussion about processes, and it can identify if there are any gaps in the problem-solving process. Would you do anything different for the next time? Now, this allows for conversations to see if a different skill has been obtained. This could also be a time to identify changes that should be made to scenarios and implementation. What was the most meaningful? What is the key takeaway from this experience for the learner? This allows you to see if your scenario was effective at meeting the goals and objectives that you initially outlined. Now, let's take a few minutes and share a few scenarios that you can use. The World Health Organization has an online training that can be used with healthcare professionals to teach hand hygiene. Now, the training includes a film that demonstrates when hand hygiene should occur. This scenario could be shown and incorporated into a discussion to elicit critical concepts on the hand washing process. Also included on this page are detailed slides with tips on how and when to discuss the scenario with the learner. Now, you could take this a step further, and you could use a scenario that involves hand washing, but focuses on a soft skill like empathy. In our example here, you're preparing to bathe a patient, and part of the scenario is washing your hands. Now, while the skill gives more realism to the scenario, the focus is on learning how to empathize with the patient. Healthcare professionals have used scenario-based learning and simulations to ensure that proper techniques are used when donning and removing PPE. The initial presentation to the learner might include the educational technique and things to remember about donning and removing PPE. A scenario-based experience could focus on problem solving or conflict management. The bathing scenario shared prior also did include donning PPE. So here's an example of a conflict management scenario. Here's the background. You are coming onto a new shift at night. The facilities are still practicing COVID-19 restrictions, requiring all patients and visitors to wear face masks whenever there is a healthcare team member in the room. After receiving shift report, you and the off-going team round to meet the patients. You enter one room and notice that neither the patient nor the family are wearing masks when you first walk in. You say, "Hi, my name is Sam, and I'll be working with you tonight. Due to the current COVID-19 pandemic, we ask everyone wear masks when a healthcare team enters the room." And the patient can say, "Hi, Sam, I don't want to wear a mask. The last person that was in here didn't make me do that." So this could lead to a branching point for the learner. And you could say, what would what would be your next response? A, "Well, I'm not the last person. This is how we do it." B, "It's okay. You do not have to wear it." Or C, "I understand it's difficult to wear a mask at all times, but for our safety, it's best that we wear one." The last scenario can also be used as a group discussion. Now, I like to use this method to help facilitate group discussion and share how others might interpret the scenario. Using the 1, 2, 4 all method, here you'd represent the scenario to the group as a whole and then ask them to think about it by themselves. And after a few minutes of thinking about the example by themselves, you would divide them into pairs to begin sharing with each other. And then depending on the group size, then you can have them or have discussion with small groups of 4. And then finally, you bring the whole group back together to have them discuss and share as a whole. Now, this is a process that can be used in person, but also virtually. Using breakout rooms in the virtual setting is important for that part. This helps to foster conversations and facilitate learning. Now, using books and websites can also help you strengthen your offering of scenarios, but you can easily do it for yourself, and we'll give you a few tips on that. Here are a few books that might offer insight in how to build clinical scenarios. Now, there's more than this, and it can be difficult to find simulation scenarios that are designed for one specific learner. When you're planning your learning opportunity, remember, tailor the experience to your student. You can scale up or scale back scenarios that are presented in books like these. These books can be purchased online, and many are even available in ebook format if you look. Now, here are several websites that have scenarios already built out or completed for nursing assistants. The first one, the Kansas Nursing Board, has 16 different ready-to-use scenarios in that library. Number 2, the Montgomery College has 16 different scenario topic areas, and one might really be useful, or one that I found on that site for CNAs is the cultural simulation. You might want to take a look at that. Number 3 in our list, the Global Network for Simulation in Healthcare, has care scenarios on topics such as sepsis, medication errors, and care teams. The Laerdal site has several complementary scenarios, and the ones that go with the and mannequin would probably be the most appropriate for CNAs, such as colostomy care, feeding by NG tube, oxygen therapy, and urinary catheterization. The California Community College Health Worker Initiative has a really long list of links to scenarios on that specific site that I looked at. The CNA online link has an interactive communication scenario that I really think would be good for virtual learning. The link of the CNAS IMVR, that link is to a provider that is still under development for CNA scenarios, but you can sign up and be on the wait list when more information comes out. So that one sounded very promising. And then the last link includes 3 free CNA critical thinking scenarios that you could use in your program, whether it be in-person learning or remote. And this is just a few that I found after a short search. Now, don't forget about us at RealityWorks. We have made all of our curricula for health science available for free at the link above. And you can click on the type of training tool, and it will take you to all of the lesson plans. For example, if we have a geriatric nursing mannequin listed under mannequins at that link, it includes multiple lessons, and in each lesson, there's an empathy scenario that can be used in your program. So please check those out. There are dozens out there. And here's one on the screen that it just happens to be all about pressure injuries, but you don't have to reinvent the wheel. We have an awful lot out there at that link that you can take and use right away. Also, get industry involved, especially in your local community. Many of you might have advisory boards that you tap into for your various CTE programs. Talk to local employers in the area you teach. Tell them that you're creating a class project and you need some help coming up with some real world scenarios that involve different soft skills. Ask them about recent scenarios they may have experienced on the job. Now, you can also get your students involved. You can ask students to create scenarios based on some of their own life and work experiences. Many of your students are now employed in some of their first jobs. You could have them share positive or negative scenarios that they've personally seen or been a part of. Talk to colleagues. More than ever, schools are tapping into people with business and industry experience to teach. So maybe you know fellow teachers in your school or district that might have worked in healthcare. Ask them for a few ideas for scenarios. Now, you could also talk to family members who may work in career fields relating to perhaps CNA or healthcare. What types of scenarios or situations have they seen or been a part of in the work environment? And if all else fails, Google it. Do keyword searches on terms like work role playing, healthcare scenarios, workforce scenarios, etc. You'd be surprised at all the things you can find that are ready to use. So here's a few key points from our discussion today. Scenario-based learning uses realistic scenarios that might be encountered. Learners find it helpful when they are able to relate to a clinical experience they've encountered or may encounter. Using this method of learning can help to promote critical thinking skills and reinforce knowledge learned. This method can also be used as a validation method to ensure that critical concepts are clear. Building your scenarios, do it using the SMART goal method. This will provide a clear and concise vision for the learner. Define the desired outcome of the scenario so that learning objectives are understood. Action checklists serve as a great guide for the facilitator and the learner during the scenarios. The case scenarios used during the sessions should incorporate needed equipment and scripts for those participating. At the completion of the scenarios, be sure to debrief. The debrief serves as a method to discuss what went well, what opportunities were presented, and how this knowledge will be used in the future. Now, here's a brand new resource we have for teaching CNA soft skills through the use of scenarios that we'd like to share. We know that saving time is really a key thing for CNA instructors. So by providing you with the things you need to implement an effective patient scenario, it will make your classroom more interactive and save you time. So by including multiple scenarios in our kits, you can also integrate a variety of scenarios for students to work through. So we have several different, we're calling them skills sim kits. We have 3 different ones that focus on nursing, and we have 2 that focus specifically on CNA skills. And we've picked the 3 here that you see on the screen that we think focus mostly on content that CNA instructors may be interested in. So each of the skills sim kits includes 3 different scenarios that focus on a specific topic. And it will give your students multiple opportunities to work through simulation exercises. Exposure to related scenarios on a single topic will reinforce your students' skills and the content that you're teaching. And our scenarios in these follow the simulation guidelines based on the INA CSL standards of best practice. So these scenarios could be used as a way to assess skill mastery as an alternative to a written assessment. There are also prompts included in the box that make the scenarios even more realistic for participants and observers. And we think that by doing that, you'll get a greater student buy-in and also have better learning outcomes. The pre-brief and debrief exercises also encourage critical thinking, problem solving, and they build in other soft skills. We have one here that focuses on geriatric medication management, focus on sensory impairment, and another kit that focuses on mobility impairment. Now, here are the parts included in each of those skills sim kits. So you get those 3 scenarios. It has the roles defined. It gives you the whole scenario, the setup, describes the patient. It gives you the pre-brief questions, the debrief questions. And then in the lesson plan itself, it's a step-by-step instructions on how to integrate the environmental props on the list to make that scenario realistic. Now, here's one more very simple yet effective way to help your students learn a variety of soft skills. And that's with our pathway-specific scenario cards written by subject matter experts. Each card in the deck focuses on a different soft skill, and there are 19 cards in a deck. Each scenario includes point of view and then also key discussion questions. And we have healthcare sets that include nursing, geriatric, sports medicine, medical assistant, and EMT scenarios. And we're going to share one scenario from the geriatric pathway set with you that you'd be able to take and try with your students. And here it is. Scenarios we know are a great way to get your students to interact with each other and the content. And this is a health science therapeutic services pathway scenario relating to geriatric care. Now, this would be perfect to use for a CNA class or a health occupations career exploration lesson. Sometimes it's fun to have your students try out their acting skills. So here's the communication scenario. While Juanita is taking care of Mr. Lopez, he falls. Juanita quickly calls for help. Helen, a nurse, arrives and assesses Mr. Lopez. He says he got dizzy when he stood up. Helen says to Juanita, "Didn't you have him sit for a while before getting up? He has problems with blood pressure. I told you that in report." Juanita realizes she did not do that and made a mistake. So you could assign your students the different roles of the person in the scenario and have them act it out in front of the class. And after the scene is done, you could ask those key questions to generate a class-wide discussion. Now, if you use this online, you could have your student role play the healthcare provider and perhaps use a family member to be the other actor. They can record it and submit it to you with answers to those key discussion questions. Now, here are a few other resources available to you that we'd like to share, and this is online courses. Here's a brand new online course on ethical and legal issues in healthcare that we now have available. In each of the 10 lessons, it features one ethical and one legal scenario related to the content of the lesson. There are also pre and post summative assessments, knowledge checks. There are 40 online assignments, but we also include an additional 40 extension activities in a workbook that relate to each lesson. There's a student dashboard, which is where students access and access the lessons to do them. But on the instructor dashboard, you get an instructor guide. There's a certificate of completion that students get at the end of it. And then there's also a tracking list of all the assignments in Excel that you can edit and put into an LMS system for tracking progress. And this is just a quick list of the 10 topics and all the online and workbook assignments. So you can see it's quite robust. And we also do have the ability for you to go on our website and try one lesson for free to see if you like it. And we also do offer the same content in what we're calling our print or paper-based version. You get student workbooks, you get scenario card decks, 5 of those so students can work through scenarios in small groups. And then the curriculum is accessed via a link so that you can easily access everything you need to teach the content. And there's approximately 10 hours of class time for this program. Now, here are the 10 lesson topics. Both the same lesson topics are in the online and the print-based course, but this just gives you an idea of the different types of things that students will have to learn through. But it's very scenario-based and puts them in the shoes of a healthcare person having to deal with some real delicate ethical and legal issues that they realistically will encounter on the job. We also have another brand new online course that is also scenario-based, and it's Developing Empathy for Effective Patient-Focused Care. And this makes a really good, approximately 1-week unit of teaching time. It's anywhere from 5 to 8 hours, depending on what you do. But there are 8 online lessons in the course, and it follows the same type of format where you have the pre and post summative assessments, you have 49 online assessments, certificate of completion, the list of assignments, and everything. So let's take a look at what the lessons include here. You've got the 8 lessons. So it's all about, they learn about what empathy is, patient communication strategies, and then applying empathy and therapeutic communication. And then after that, they have 5 very robust lessons. And each lesson includes multiple types of scenarios that they are learning how to focus, being empathetic, and so forth. So a very unique take on developing effective patient-focused care that is brand new and available. So if you find yourself needing more content for remote learners, this might be a very nice supplement to what you're doing. At this point, we would also like to share some additional resources. First of all, RealityWorks has a lot of different webinars, and each month we schedule new webinars that you can sign up for free. If you go to the link that you see on the screen, if you sign up, but even if you can't attend, we will send you the recording or the link to the recording at the end. You will receive sometimes handouts, and you'll receive a copy of the presentation itself. But there's a lot of good upcoming webinars for health science, but we also record everything and have it available on demand and as a free archived webinar as well. So if you click on the link and you click on health science, it will take you to a plethora of webinar opportunities, and many of them focused on CNA skills. Another thing we've got is a free 5-lesson unit on health science careers in a variety of different pathways. And it's an easy way to supplement what you're already doing. You could choose 1 lesson or all 5, but at the link that you see here, it's on our website. You can go ahead and it just gives you some free content for career exploration in health science. Another few things that we have for free resources that are available. We have some free posters, kind of infographics that focus on healthcare careers. We also have some on very specific healthcare careers like EMT, sports medicine. That's available at the link that you see. And then we also have a brand new CNA program implementation guide. And if you go there, it will give you some ideas for how to integrate some of the products we have, some of the lesson content, but it's a very helpful guide that you can download for free, especially helpful if you are starting a brand new CNA program in your CTE area. A few more additional resources that we like to point out. There's a RealityWorks blog at this link, and we are frequently updating that with inviting guest blog writers, any new product launches. We have best practices, class lesson plan ideas. So that's a good place to go for some new information. We also try to be very busy and engaged on social media. So we do have a Facebook account as well as Twitter, but we also frequently are out on other sites such as the National Consortium for Health Science Education. It has a Health Science Education Association Facebook site that's very engaging, and many times we're watching that to see if there's questions or things we can share on that as well. So we hope that you found this session helpful and that you've got a few new lesson plan ideas and ways to use scenarios in your CNA programs. Thank you very much for attending our session today.